PFS, Patellofemoral Syndrome. What is it? Sounds real complicated, but it's something that happens quite often, especially in athletic people. It's pain that can occur at the front of the knee, around the kneecap. It's also known as runner's knee. It's a dull ache that tends not to go away as long as you're active. Now, with that, you can see things like injuries from falling down. You can see it in workplace where you're doing the same thing over and over again. If you're working concrete, if you're laying tile, you're prone to bend your knees. You can also see it in like a secretarial workplace where you're sitting down all day and your knees are in the same bent position. That is providing a lot of pressure on the front of the knee and will result in this syndrome. Now, some of the other things that you can see with it are patients that have muscle weakness. As you get older, if you were a runner when you were younger, those muscles start to atrophy or shrink. So as you're not using them, they become weak, and the muscles that generally hold that knee in place and the tendons around it, as they weaken, that kneecap can shift and move. The other thing that can happen is the muscles in your hip that also correspond to your kneecap as they run down your leg, as they become weak, they cannot keep that knee in the same place that they once did, which will cause this syndrome, which will bring on the dull ache that you feel. As far as risk factors, like I said, if you've had an injury, you're going to be more prone to it. If you're doing the same type of work day in and day out, you're going to be more prone to it. Women are twice as likely as men to have it, especially as they get out of the teenage years into the young adult years. Most likely this is going to be seen in elderly teenagers, the 18, 19-year-old into the early 20s. When things are starting to go away, like the sports that you once did, the muscles that you once had built up, they're starting to fade out because you're not doing it as often, you're going to be more prone to that. Certain sports, and not the high contact that you normally would think of, like football, hockey, that kind of thing, even volleyball where you're crashing into your knees all the time, but running sports, soccer, and long distance running especially, where you're going to have issues with this. And then kids that go through a lot of growth spurts where their muscle is not catching up to the way that they're growing up, it's not going to hold that knee in place, so they're going to have issues with PFS. As far as prevention, what can you do? Well, number one is lose weight. You're putting extra pressure on your joints and on that knee for every 5 pounds that you are above your ideal weight. The other thing is continue to exercise. Just because you're not doing those sports anymore doesn't mean you need to not do something to stay in shape and stay healthy. You may not be able to run like you used to, but you can sure walk. If you can keep on doing those exercises to keep those muscles built up and to keep those joints moving, it will help. The other thing that you can do, especially if you get older and have this, is see a physical therapist. They can do things and show you exercises and trainings to work those hip muscles and the knee muscles in a safe manner that won't cause you pain. And they'll be able to do some stretches as well to loosen that, not only the joints but the ligaments up, that will help to take care of PFS. It's very important whenever you're doing anything, especially as you get older, that you do stretch and warm up. Not just for sports, but if you're working concrete, if you're laying tile, you're doing things like that where you're going to be on your knees, even gardening. If you're going to spend an afternoon in the garden, make sure you stretch out before you get to work on it, and stretch throughout the day. Don't keep your knee in the same bent position for long periods of time. Remember to build up slowly as you're going. You don't want to put too much pressure on that knee where you're harming it the other way. Something else that's very important for this, as well as a lot of issues that you can have with your gait, and that is good shoes. You need to get a good high quality shoe that will help out on a daily basis with you, with both your knees and your hips and movement. I myself, I recommend Asics Gel. They're a great shoe. I also like Curry's. They've been a great shoe for me as well. As far as treatment, what can you do? Well, you can take over-the-counter Tylenol, ibuprofen, or Aleve. Remember, if you have stomach issues or heart issues, try and stay away from the ibuprofen and Aleve. You can also use ice on the knee, both the front and the side. 20 minutes on, 20 minutes off is the best thing. Like I said, physical therapy would be a big help. And a knee brace, if you can get a knee brace or tape it, which you can learn from a physical therapist how to tape it, that will give you some support, especially if you're doing physical activities like sports or working concrete, that kind of thing, to help you during the day. But the most important thing if you're having that kind of pain is just give it rest. If you have to sit down, keep your knee extended instead of in a bend. If you have to be on your knees, get some knee pads that will help, or try and shift to your rear end instead of being directly on your knee.